Hello and welcome to Talking Points. I'm Dave Kelly, Director of Advanced Media Production at Cal State Long Beach. Today we're going to focus on staying healthy and avoiding the pitfalls on the pathway to good health. My guest today is Dr. Catherine Cummins. Dr. Cummins is an Associate Professor of Nursing in the Graduate Division, and she is also a staff physician at the University of California, Irvine Student Health Services. Welcome, Kathy, and thank you for joining us on Talking Points.
Hello, Dave. Thank you very much for having me. It's great to be here.
Well, let's start by acknowledging that we're taping this at the tail end of the cold and flu season. And for those of us that have managed to avoid those dreaded viruses, what can we do now to continue to maintain our health? And what are some good guidelines for maintaining a healthy immune system in general?
So those are all excellent questions. As a clinician in primary care, most of us feel that one of the most important cornerstones to staying healthy is staying very physically active, resting, staying hydrated. Other things include annual flu vaccinations, which is recommended by the CDC. Hand hygiene is also important. Keeping your hands clean with just simple soap and water. Also eating healthy nutritious foods and getting plenty of rest.
And if we do happen to catch one of those nasty viruses and we know we're sick, what do we need to do to get over it as soon as possible? Now, I know you're going to tell me that people say they don't take time out to take care of the problem because the phrase here in Southern California is, I don't have time to be sick. What about that?
That's what I hear a lot when I see patients in clinic, and I understand the California lifestyle is very active and very busy, and we're very productive people. However, when you get sick with the flu or a severe viral illness, it is really important to listen to your body. If you're running a fever and you're coughing, the CDC guidelines are very clear. You need to cover your cough, you need to stay at home and rest. One of the most important things is once you do get sick, to please not spread it beyond your own premises or your own household. That keeps other people from getting sick. Then when you do become unwell, it's really important for you to, again, we talked about healthy lifestyle. You need to stay home, you need to get rest. If you're running a fever, there's appropriate medication over the counter to control your fever. You need to be staying hydrated, eat healthy, and get plenty of rest.
And I want to also pick up on that theme of taking care of it immediately, because those folks that I referenced that say, I don't have time to be sick, it's actually counterproductive, because if they don't take care of it early on, it can get worse. And you mentioned to me off camera that what usually happens is they develop a secondary infection, which complicates things even more.
Dave, that's exactly right. We run into this problem all the time in primary care, healthcare. What is important is that when you do get sick and you're feeling extremely unwell, you do need to stay home and get rest. But by staying at work, working hard, not getting the rest you need, it forces your body to work even harder. And your own body, I tell people, if you don't take care of your body can't take care of you. And so really important, because if you keep pushing yourself, it is possible to have the viral illness, then move on to what you stated as secondary bacterial infection, which indeed makes prescribing antimicrobial agents much more necessary. And we really, as providers, we'd like not to have to prescribe antibiotics. So if you stay home, get the rest you need, treat the symptoms, you should be able, as a healthy individual, overcome the illness.
Now you're mentioning antimicrobial agents and antibiotics and so forth, and we know that if you get a virus, viruses typically don't respond to antibiotics. And so if you go to the doctor and the doctor determines that it's really a virus that you're suffering from, don't expect antibiotics. And we've also had this concern that antibiotics are being overused, or they're being abused, or they're being overprescribed, leading to the potential of antibiotic-resistant organisms developing, which would be much worse for our society as a whole. What about that? Antibiotics don't work against viruses, and so if we go to the doctor, what can we expect from the doctor based on how long we've had the illness and what the diagnosis might be?
So again, the CDC guidelines are very clear. As we stated before, when you initially get sick in that first 24, 48, 72 hours, please stay home, rest, take care of your symptoms, manage your fever, and stay hydrated. Running to the doctor or the nurse practitioner or the healthcare provider to get antibiotics very quickly in the illness does nothing more than, as you stated, increase the incidence of antibiotic resistance. But as we alluded to before, antimicrobial resistance is actually one of our greatest public health concerns, both nationwide and we're seeing it worldwide. And so it's important that as consumers of healthcare, that when we go to be seen, we understand that the provider, while it may seem like, gosh, why didn't that provider give me antibiotics? They're also trying to be a patient advocate and maybe not prescribe you an antibiotic when they understand it's the viral phase of the illness. If you do take care of yourself as a healthy, immunocompetent individual, you should be able to recover without those prescription antibiotics.
Well, let's talk about hand soaps and detergents and things of that nature that are antibacterial. Now, some are saying that we're overdoing it in that way as well. Yes, we want to wash our hands. That's an important hygiene characteristic if we want to stay healthy. But do we need all the antibacterial soaps and so on, or is it not really helping us as much as we think?
Well, that's a really interesting question, Dave. So again, to review with the CDC guidelines. So for people who have soiled hands, say your child has been on the playground, they've been running and touching the sand and the dirt, and they come back and they have visibly dirty hands. The guidelines are clear. They should be using soap and water. It's not necessary to use an antimicrobial soap per se, but just a simple soap with running water. The reason why is because the dirt may contain spores and other bacterial elements that a simple hand wipe gel couldn't take care of. But if there is no visible dirt or there's nothing else available, these simple hand gels are also considered sufficient, but they're second to using running water and soap.
And I know that there's an element in antibacterial soap called triclosan, a chemical that FDA is really keeping their eye on. Why is that?
So that's a really interesting question. Triclosan is an agent that's found in antimicrobial soaps, antibacterial soaps, and there's certain animal studies that they've been looking at that where they're concerned that prolonged exposure to this agent, which has antimicrobial properties, can also be possibly absorbed through the skin and cause some, in animal models, some hormonal disturbances. And the trouble is we don't have enough longitudinal data to know for sure, but why would you risk that potential hazard if you could use simple soap and water to take care of the problem initially?
Okay, and so when we talk about the use or potential overuse of antibiotics, we also know that in agriculture today, there's a lot of prophylactic use of antibiotics in livestock.
Yes.
And is that a problem? Why might it be a problem? And anticipating your answer that it might be a problem, should we be going to the grocery store and looking for antibiotic-free chicken and maybe meat that's packaged that says not using human growth hormones and those kinds of things?
Yes, that's a really important public health concern. In fact, the FDA is keeping a very close eye on this. The problem is that the agricultural industry, in their hope to also be very productive, try to increase their production by protecting their animals with sort of prophylactic antibiotic use and some hormone therapy. But the trouble is that with this is we don't have enough longitudinal data, again, to know the absolute effects, but we are monitoring this very closely because we are very concerned that the exposure of antibiotics through the animal food chain, even with eggs, poultry, beef, etc., by consuming those products, we are in turn also consuming unwittingly the antibiotics, and then therefore as we consume that, the gut bacteria especially are getting exposed to unnecessary antibiotics, and therefore the bacteria are very smart. They get exposed to it, their job is to survive, and they produce genetic pieces of material that helps them survive and continue to reproduce.
Okay, I'm going to sort of flip the switch a little bit here and talk about whether or not we need to be concerned about being too clean. In other words, are we too clean, especially with our kids? We want to keep them squeaky clean. We don't want them to get dirty. We don't want them to get infected with any viruses. But if that means in a typical urban environment, we don't let the kids go out and play, they don't get the exposure of playing in the dirt and getting their hands dirty and so on, is that actually inhibiting their ability to develop a normal immune response to some of the so-called friendly germs that we've had around us for thousands of years?
So, Dave, that's a really interesting question, and there is something called the hygiene hypothesis that was put forward by a Professor Strachan from the United Kingdom in 1989, and he proposed that it's possible that we are so purposefully protecting our young children from getting exposed to dirts and animal byproducts, etc., that we may be harming them by not allowing immune systems to be a little bit exposed to these allergens, if you will. And so early on in life, babies, the immune system is getting exposed to antigens and then producing an antibiotic or response, immunologic response. And so if we protect them too long from healthy types of bacteria, it's possible that they could in turn see everything later in life as foreign and then possibly have a little exaggerated immune response.
And so I think that that's why we're seeing, or at least there have been some suggestions that we're seeing more allergies in children today, like peanut allergies and allergies to other food products, that maybe that's a result of trying to keep the kids so clean and so pure in their early days that they're not developing the kind of immune response that would attack the regular germs, the normal friendly germs, and those immune systems need to do something, so they go after the peanuts and the gluten and the other elements that children are ingesting. So we only have about a minute to the break, so if we can keep this short. What about that and the incidence of allergies may be increasing today?
So that's a really important question, and epidemiologically speaking, we do see possibly a bit more allergy. We obviously see it quite a bit in primary care. This is a major concern. The CDC guidelines for nutritional introduction into the pediatric population, babies, the recommendation, of course, is breast milk for the first 6 months if possible, but the slow introduction of different foods at about 6 months of age. And you're right, if we delay too long the exposure to any kind of food products, it's possible that later in life, again, all of these overwhelm the immune system and seen as foreign, and so you see a bit of an exaggerated immune response.
And on that note, we are going to go to the break, and stay with us. When we come back from the break, we'll talk about vitamins, dietary supplements, and also exposure to the sun. How much should we have and how much is safe? Stay tuned.
Get involved. Become a leader in the well-being of our nation, actively lending your voice and energy to promote wellness. Be the voice for public education and health education in schools, community organizations, hospitals, and clinics. You can become part of this exciting field with a degree from Cal State Long Beach.
Welcome back to Talking Points. I'm Dave Kelly, and my guest today is Dr. Catherine Cummins. And Kathy, before the break, we were talking about antibiotics, antibiotic resistance, or the avoidance of that. We also talked about being maybe a little too clean with our children and not allowing their immune systems to develop naturally through exposure to the so-called friendly germs that are around us everywhere. We also ended on allergies. And I mentioned when we went to the T's that we were going to start by talking about vitamins, dietary supplements, and sun exposure. So we're going to start with that in the second half. So let's talk about vitamins and dietary supplements. Do we need vitamins? And if so, what kind of vitamins should we be taking?
Okay, so an excellent question, Dave. So basically what I recommend to people in general, that if you're if you're living healthy, you're having a nutritious diet, nutritious intake, most nutritionists would tell you, you don't need to take a supplement. That being said, there are some benefits to taking some vitamin supplements, and many people do. So I'd say there's some specific vitamins, vitamins C and E, which people feel from an immunologic perspective are antioxidants, and that can help with the immune system. We talked about that a little bit in our last segment. We also can recommend, we were going to allude to vitamin D and calcium, which are two very important components in the diet that I do talk a lot about, especially young women and postmenopausal women to supplement as well. There are some vitamin B supplements that are important, and then there's even omega-3s now that we're getting very interested in from a cardiovascular and different perspective.
Now, if I happen to be a vegetarian or even a vegan, there's a debate about this as to whether the vegetarians and vegans are getting enough protein. And I suppose that depends on the diet and what's in the diet. Mm-hmm. But if I am a vegan or a vegetarian, should I be looking at some sort of protein supplements or perhaps amino-3 fatty acid supplements or things of that nature?
I would say in general, and I do have a few patients that I see, that I do recommend making sure that they do get enough protein supplementation. If it depends on, again, what they're taking in as their dietary protein.
And these are the vegetarians or the vegans?
Mm-hmm, that's correct.
Right. What do you look for in terms of when you're analyzing someone's diet, if you get to that level with nutrition? What kinds of things do you look for in terms of a healthy diet?
So diet, there's many different ways to look at it. So typically I'll spend time talking to patients, just say, tell me about your day. How do you start your day? Do you have breakfast? My first question is, do you have breakfast? And then they'll look and say, well, I'm pretty busy and I don't often have time for that. And so I said, well, you know what breakfast, how that word was originated, to break your fast. So you should break your fast in the morning. It's really important. I find a lot of people who don't eat breakfast and delay their first meal of the day tend to be so hungry that by the time they eat, their food selection of nutritious foods may not be all that perfect. So I do talk a lot about small, frequent meals. We deal a lot with people who have metabolic disorders, perhaps hyperglycemia, prediabetes. It's really important to eat small, frequent meals because having a relatively low blood sugar can lead to a lot of symptoms such as headache, not feeling well, fatigue, etc. And the other thing is, with those meals, a little bit of protein with carbohydrate to regulate the blood sugar, etc. And then there's guidelines set forth by the CDC that recommend, I think, of 3s for 3 meals of the day. So there should be at least 3 vegetables, 3 to 5 servings of vegetables, 3 servings of fruit, 3 dairy type products, 3 sources of protein, only a very small sprinkling of the fats and sugars, and about 6 of the whole grain type of servings per day. So those are some general guidelines.
Now, if people come to you and say, well, I just can't seem to tolerate vegetables or fruits or something of that nature, and if that happens to be true, is that when they should be looking at supplements to provide the vitamins that would replace that?
Sure. If there's maybe a food allergy perhaps, or something along those lines, definitely I would go ahead and move to some kind of supplementation there, because it is important to maintain your health, to have all the required vitamins and nutrients daily.
Okay, well, let's talk about vitamin D and calcium, because you mentioned that a moment
Yes.
ago. So if we're going to absorb calcium into the body, we need the active agent vitamin D to make that happen.
Mm-hmm. That's correct. The purpose of vitamin D, it has many functions, but one of them is to help the body absorb calcium. Calcium is an element, as you know, and we aren't really physiologically well prepared to absorb it. And so that's why you'll see that when people prescribe it, it's often several times a day. And it's because we don't have the ability to absorb it very well. So the function of vitamin D is to basically be a carrier for that calcium to get into the bloodstream. Calcium, obviously, very important for that strengthening of the bone, especially I find in young pre-adolescent girls, young women, very important in those early years to make sure there's a good calcium vitamin D intake, because if you don't begin with healthy, strong bones, you're going to have a hard time going through hormonal changes to try to maintain healthy, strong bones. So
Well,
very important.
When we talk about vitamin D, we also know that the sun, exposure to the sun helps stimulate vitamin D activation in the body. So if we're getting a sufficient amount of sun, is that going to stimulate the vitamin D to absorb the calcium and other nutrients? And isn't also sun exposure and the vitamin D critical to immune system, strengthening the immune system as well?
So again, everything in moderation. Obviously, some exposure is good, but again, speaking from a dermatologic perspective, the American Academy of Dermatology does recommend limiting ultraviolet radiation exposure. So we do make a lot of recommendation about protecting the skin, because of obviously the worry of skin cancer and melanoma is very serious, worldwide and in this country as well. And California is we have a lot of sun here. So while a little bit of sun exposure, that's okay to be healthy, but again, not a bad idea to consider supplementing to make sure, because if you screened a large portion of the population, you would probably find most people are vitamin D deficient. That's what we're seeing now as a trend in the medical literature.
And I happen to know that you also practiced medicine in Australia for a while prior to coming here and being involved in UCI and also Cal State Long Beach. So in that instance in Australia, obviously they had some issues with sun there too.
Exactly. It's probably multifactorial. I attended University of Sydney Medical School, and basically, atmospherically, they had a lot of ultraviolet exposure there because of their location, and they had a greater amount of ultraviolet rays that occurred in that general area. Also, it tends to be there's just a higher incidence of melanoma there due to the overexposure of ultraviolet rays.
And so there are some similarities between California and Australia in that regard. And I know that one of the solutions has been topical chemicals, sunscreens and sunblocks and suntan oil and that kind of thing. What about that? Are those chemicals effective? Do they work well? Are there some precautionary things to consider with suntan oils or sunscreens?
So a good resource for the listeners would be to go to the American Academy of Dermatology. They have a website, and they actually have an entire recommendation for sunscreen and sun exposure. Again, our biggest worry is overexposure to ultraviolet light, which leads to skin cancers. Predominantly, a big concern is melanoma. And the recommendation primary is to, first of all, try to avoid a lot of sun exposure, because that does damage the skin and lead to skin cancers. So physical blocks, such as wearing large brimmed hats, choosing your time of day to go out and do the activity, try to avoid the high noon period of time where the sunlight is having its greatest effect of radiation. There's also things like wearing sun shirts. People can actually purchase shirts that actually have UV protection in them, which is great for people who go on big hiking trips, etc. You can buy shirts for hiking where it will reduce your exposure. So a physical block is best if you can. If that's not an option, sunscreen is important. They do recommend application about 30 minutes before going out into the sun. It should be water resistant sunscreen. SPFs of a minimum of 30, and usually not much more effective over 50. So between 30 and 50. And the FDA is constantly regulating the different chemicals that are authorized to be used in sunscreen. And in general, the American Academy of Dermatologists, any sunscreen, as long as it's broad spectrum, UVA, UVB, and typically need to reapply during the day once or twice, depending on the length of exposure.
Well, let's talk now about these pandemic threats of viruses that we've been hearing, H1N1, swine flu that we heard about a few years ago. And there was also the Ebola virus in Africa a couple of years ago. And these tend to make big headlines. We tend to get a little bit concerned about that here in this country. The media picks up on the theme and maybe makes it front and center stage for all of us. Are we too concerned about these pandemics? Are we in a position to control these better than we were, say, the 1918 flu virus that spread around the world?
So that's a really important question. I would say it's becoming a bigger issue probably because we are all traveling. People travel worldwide now. It's very common. And it is true that, especially you mentioned Ebola, the cases that we had here were actually cases that crossed our borders via aviation. So it is possible for these things to happen. Now, that being said, the one thing I could say is CDC does a very good job of monitoring concerning viruses such as the great flu that you described and Ebola. We are watching these very carefully, and in the case of Ebola, they did a very good job of monitoring very closely what was happening and where these cases came from, and there were even a few clinical trials, new drugs that they used to be treating some of these patients, and there were survivors. So they did a great job in taking care of it. The biggest thing is quarantine. Once we identify a serious virus coming in, it needs to be reported very quickly, and then we need to try to isolate and contain that virus the best we can. Being an informed consumer, knowing if there's CDC alerts, they're very good at getting that information out there. It may make people very concerned and worried, but it's also important to be honest to the public to let them know there is a concern of a certain virus in a certain area, if there's certain conditions that a person may have that would put them at greater risk for an illness or disease, they should be aware of that possible exposure.
Okay, well, on that note, we've unfortunately run out of time, but I want to thank you for being here today and sharing those very important tips with us.
Very good. Thank you so much for having me. It was a pleasure to be here.
And we want to thank you for joining us on this edition of Talking Points. Be sure to join us again soon for the next edition. Until then, I'm Dave Kelly. Have a nice day.